بس هاي okay. 43 years old female patient presented with increasing dyspnea, and she was sent for pulmonary CT angio. العفو أستاذ، طالعة الصورة؟
عابد اي نعم
أي.
موجود.
يعني هسه إنه
هارو شفتي بدي تشوفي
axial CT scan images with both contrast and sagittal. يعني ال obvious there is a right-sided aortic arch.
نعم.
بس رجع صعدي لي فوق there is إنه ال pulmonary artery is hypoplasia. إيه يعني I see small right-sided aortic arch, pulmonary artery hypoplasia. There is some collateral seen.
نعم.
بعد شوي يمشي كهارت. أكو يعني VSD defect. There's VSD defect.
نعم.
زين أكو coronal.
يعني أسوي reconstruction، لأنه هم يعني الأنجيو بس يسوون أكسيال.
هو over يعني right-sided aortic arch patient and pulmonary hypoplasia and VSD defect overriding of the aorta. هنا وعنده VSD defect. رجعي لي على الأكزيال. إذا right يعني يمكن right ventricular hypertrophy.
يعني all in all شنو هذا؟
يعني هو إذا right sided aortic arch pulmonary hypoplasia VSD يعني كهاي كرايتيريا كلها تمشي ويا يعني فشي congenital heart disease like trilogy of Fallot
يوس
cardiac anomalies. يعني لين جمع هاي الكرايتيريا كلها.
نعم.
بس غير شي مدى أشوف كلام أو شي.
زين بالنسبه للفحص هو التايمينج مالته شنو الملاحظه اللي نشوفها احنا يعني بالتايمينج هذا؟ التايمينج هو مضبوط اكيد لان هم مشتغلين بابن البيطار هذا.
اي
تشوفين الدنسيتي مال الكونتراست بالايورتا وبالبلمونري ارتري
اي
ايدنتيكال مو نفس الدنسيتي مال الكونتراست.
يعني أنا أشوف ما أدري
pulmonary artery
اي نفس
بالأيورتا.
الدنس.
هذا البلمونري فين هذا الارتري نفس
اي
الدنسيتي.
نفس
وهذا
الدنسيتي.
يعطيك فكره انه there is shunting of blood مو للسيستميك مو للبلمونري circulation.
صحيح تمام. فهو نفس
اوكي
الدنس.
شكرا رؤى.
تمام.
نغم عبد الزهرة موجودة؟
بلي أستاذ السلام عليكم.
عليكم السلام ورحمة الله وبركاته. تفضلي نغم.
عمل سي تي انجيو اوف ذا تشيست مثل ما قالت الدكتورة رايت سايدد ايورتيك ارش البولمينري ارتري سمول اور اتنيويتد. انا شفت بالساجيتال بس الساجيتال عفوا دكتورة. اكو ساجيتال؟
نور ويانا؟ نور.
عم شفت بالساجيتال اكو اوفر رايدنج يعني الايورتا صار اوفر رايدد على الرايت فنتريكل والليفت فنتريكلز وسمول بي اس دي هم كانت موجودة.
نعم.
دايليتد بولمينري فين تورتواس.
نعم.
زين إذا طلعنا الدكتورة
أعتقد فصلت
الكيس هي known case of astrology يعني of Fallot since childhood يعني بس her parents refused إنه يسوي لها surgery فبقت يعني with no repair لحد هذا العمر. فهي اجت هسه على مود يعني يريدون يسووا لها عملية. طبعا هي الفايندينجز كان اكو يعني هي صعب اشرحها بدون هذه right sided aortic arch. كان عندنا ال overriding aorta والaorta pulmonary collaterals همين ال right ventricular hypertrophy والDSD. Tetralogy of Fallot cardiac imaging evaluation. Tetralogy of Fallot is the most common cyanotic congenital heart disease. It is classically present by VSD, right ventricular outflow obstruction, overriding of aorta, and right ventricular hypertrophy. The one thing that makes tetralogy is the conal septum. So the conal septum, it is the superior part of the interventricular septum. In the tetralogy, the conal septum will be displaced superiorly and anteriorly and to the right, thus making the large VSD. Also, the conal septum will squeeze the pulmonary outflow, and also the malalignment of the conal septum and the rest of interventricular septum will cause the aorta to override the interventricular septum. And as a result of the huge VSD and the pressure from the systemic circulation, the right ventricle will hypertrophy. Clinical presentation depends on the degree of pulmonary stenosis. In the mild cases, the patient won't be cyanotic. The patient will be pink, and it's called the pink tetralogy. And the baby will not be sick as a newborn, but with time, if the defect is not repaired, he will be cyanotic. In the moderate, there's a well-balanced circulation and the patient is stable. In the severe, like in our case, where there's pulmonary atresia, the blood will get into the lung via either patent ductus arteriosus or the aorta pulmonary collaterals. We start with the plain radiograph. The classical boot-shaped heart, as we all know, the elevation of the cardiac apex due to the right ventricular hypertrophy. Echocardiography is the first-line modality throughout the patient's lifetime, from fetal diagnosis to evaluation of late complications in older adults. In young patients with good window and few expected complications, it may be the only test needed. So here's an example of the, this is on the left is the 4-chamber view of the echo, and the same patient with 5-chamber view. In the 4-chamber view, it looks normal, but in the 5-chamber view, the large VSD and the dilated override aorta. MRI is not needed during the first decade of life, as echo is enough for diagnosis. But in clinical practice, cardiac MRI has advantage over echo in the accurate quantification of biventricular size and function, and is the gold standard for volume and flow assessment. CT has the highest spatial resolution of all imaging technique. This allows more detailed assessment of small vessel anatomy and the collaterals, and also it is useful for coronary artery imaging, since anomalous coronary origin occur in 8 to 12% of tetralogy patients. This is an example of the classical tetralogy of Fallot. This is cardiac MRI. On this sagittal view, because of the anterior and superior displacement of the conal septum, thus result in moderate to severe stenosis of the right ventricular outflow, and also this is the VSD. And on the axial view, we see the diffusely hypoplastic pulmonary artery. This is an example of extreme tetralogy. This is cardiac CT. Here we can see the right ventricular hypertrophy and the VSD. On these two images, we see the main pulmonary artery, the hypoplasia. And on this view, we see the right-sided aortic arch. And here we see the pulmonary valve atresia. This is also an example of extreme tetralogy. This is the cardiac CT. We see the VSD, the right ventricular hypertrophy, the hypoplasia of the pulmonary arteries. And here's the patent ductus arteriosus supplying the pulmonary branch. Associated defect, branch pulmonary stenosis, right aortic arch, ascending aortic dilatation with or without regurgitation, ASD, anomalous coronary origin, and persistent left-sided superior vena cava. So this is an example of tetralogy of Fallot with associated ASD, and then it's called the pentology of Fallot. So here's the right ventricular hypertrophy, the right ventricular outflow obstruction, overriding of aorta and the VSD, and this is the ASD. And also because the clockwise rotation of the aortic arch is usually encountered in a patient with tetralogy, this leads to rotation of the origin of the coronary artery. So this is an example of the coronary artery arrangement in patient with tetralogy. We see here the aberrant left main coronary artery arising from the right coronary artery and crossing the right ventricular outflow tract. And also there is a large conal branch. Treatment, primary repair, total correction is now the preferred treatment and is usually performed at the time of diagnosis. Shunts are only performed as palliative procedure in inoperable cases to bridge patient until the repair can be carried out, typically in the setting of pulmonary arterial hypoplasia. Thank you.
شكرا جزيلا دكتور.